Hello, this is Bill Morgan, president of Parker University, and today I have with me neurosurgeon Rick Weiner. Rick, welcome to Parker University.
Thank you. Appreciate it, and great to be here.
Oh, good. We've been having a nice conversation about one of my favorite topics is spine care, and in our conversations we were talking about the need to stick with the most conservative care practical for a patient.
That's absolutely true. You know, I'm a neurosurgeon, but we're very concerned at when to apply surgical techniques and when not to. And what I've found through the years is that the groups, the group of people, the group of physicians, of doctors that seem to understand this more than many are chiropractors. And we didn't realize that for a number of years, and then slowly started getting more and more referrals when it was appropriate for surgical care. Otherwise, we try to maintain conservative care as well.
And we were talking about my experience at Walter Reed, where when I would make a referral to neurosurgery, they frequently would ask me when was the last time the patient had eaten, because they knew I gave them good referrals. But also, you find that a lot of other groups are moving too fast into the more aggressive treatments and opiates and epidural injections and surgery.
I think so. When a patient comes primarily to be diagnosed, it really depends on who sees them initially as to what path they're going to take for their pain control and for their diagnosis and treatment. And the problem is many patients aren't being seen appropriately, I feel. And they're started on too many injections or opiates that wind up being, guess what, a national epidemic. And that's why the government has come down hard on it, because they've seen that there's a huge issue. It makes it more difficult for us surgeons, us neurosurgeons, if we're going to do spine surgery and someone has been on long-term narcotics, they are tolerant to medication. So if you operate on them, very difficult to treat them post-operatively. I have a woman in the hospital right now whom been on narcotics for 10 years and had very difficult spine issues that we have corrected, I hope. She's better today, but she's going to have to be discharged on opiates like she came in on, and then slowly weaned in a appropriate manner.
And I've known neurosurgeons who won't operate on people till they've been weaned off the opiates because it will make a difference. The little rat inside their brain that pushes the button for pleasure, it starts pushing the button that says back pain because it wants the candy. As chiropractors, our philosophy is our goal is to remove the barrier to the full expression of health and well-being. So we're not a drug, we're not a drug profession, we're not an intervention, but our goal is, you've walked around the campus today, you've seen students learning how to remove barriers to good health. So that's our philosophy. How does that fit in with your philosophy?
It fits in very well. And the reason is that I'm in a group of 7 neurosurgeons, Dallas Neurosurgical. We've been in Dallas for over 50 years. We're in Dallas, and we've up in Plano and just all the surrounding areas. And so our intake for patients is very varied. And the idea is for us to see the patient, and you'd be surprised how many patients are referred for an evaluation that don't see the surgeon. They'll see an ancillary, either a pain doc physician or a mid-level, all well-meaning, but really not getting to the heart of the matter. Does this patient need surgery? Can this patient be managed conservatively? That's what our group does.
And my philosophy is we always start with the safest treatment possible, the most conservative treatment possible. Usually as a chiropractor, that's our care. But as we talked about earlier, if someone came in with a conus medullaris syndrome, the most safe procedure you could do, the most conservative care you could do, was get them to a neurosurgeon.
Right away.
Right away.
Yes, because there are certain surgical emergencies with both brain and spine.
Truly. Now, it was kind of odd as our conversations you've got a group of neurosurgeons who are you're getting this beginning interactions with chiropractors, and you're liking what you're seeing, but you're reaching out to us trying to have a collaborative relationship.
That's true, because I feel that it's going to benefit us to learn more about conservative care and what the alternatives are from the chiropractic community, because I personally have been very impressed with the patients that have been referred through chiropractic treatment and the knowledge that the chiropractors seem to have and the educational opportunities and the education that they get in that specialty. You know, traditionally, MDs in certain areas, I don't think in Texas as much as in other states, just really did not recognize chiropractic care at all, and I think that's very wrong. And so as a group of neurosurgeons, we want to really kind of partner up and learn more as well as impart education, and in the process, help your patients with our treatments if it's necessary.
There's a continuum of care. We start here and we keep working our way up, especially when there's complicated spine conditions, deformations, spinal cord tumors, cranial problems. I mean,
Right.
We want to make sure that we get the patient to the correct, give them the correct care, and also have the interaction between the professions so that the patients can benefit.
Absolutely. I totally agree.
Well, Dr. Weiner, thank you so much for visiting today, and welcome to Parker.
Thank you, Morgan. Appreciate it.